A third dose of the Pfizer-BioNTech Covid-19 vaccine has been found to be 86% effective in preventing infection among those ages 60 and up, a new study by one of Israel's top healthcare providers shows, as the Biden administration prepares to roll out booster shots for Americans next month. Experts and pharmaceutical companies all believe it is likely vaccine recipients will need a booster dose to bolster flagging immunity at some point, though the extent of a second dose's lasting efficacy is still unclear. Pfizer reports its two-dose vaccine efficacy falls from 96% to 84% after 6 months and says results from clinical trials evaluating the safety, tolerability and efficacy of a third dose are expected shortly. Meanwhile, U.S. health officials have grown increasingly concerned about the waning efficacy of vaccines given growing data from Israel and other countries that started inoculating their populations before the U.S. Although right now, it is still as if our vaccine protection is working really well, we don't want to wait until it's too late, so that's why we're looking at the data, NIH Director Dr. Francis Collins said Tuesday. Officials have yet to make a decision on whether a second dose of the one-dose Johnson & Johnson vaccine should be recommended. The available data make very clear that protection against SARS-CoV-2 infection begins to decrease over time following the initial doses of vaccination, and in association with the dominance of the Delta variant, we are starting to see evidence of reduced protection against mild and moderate disease, CDC Director Dr. Rochelle Walensky, White House Chief Medical Advisor Dr. Anthony Fauci and other U.S. health officials said in a Wednesday statement. 168.9 million. That's how many Americans, about 51% of the population, that have been fully vaccinated against COVID-19. When will you need a COVID booster shot? Pfizer monitors breakthrough infections as experts say more data is needed. Forbes, when will you need a third COVID vaccine dose? Here's what the experts say. Forbes.